Well, experts have told us that the floodwaters could pose a serious health risk. Now, we got some of the floodwater analysed, there it is there, and came up with some pretty worrying results. Our health correspondent Catherine Jones joins me now alongside microbiologist Nicholas Daines. Good to have you both on the programme tonight. So what did you find, Cathy?
Well, this sample was collected last night from Staines in Surrey, and we've had it tested for faecal contamination. Not a pleasant subject, but remember the water has been through flooded barns where animals are kept, septic tanks close to people's toilets, so this is a real concern. We've run 2 tests on it where the colour indicates the bacteria levels. It goes yellow for strains that are commonly found in faeces and fluorescent blue specifically for E. coli, which has a scary reputation, but actually what they were looking for was harmless strains of E. coli that are found in faeces, so it's a marker. And as you can see from our pictures, it went like a Christmas tree, both yellow and blue. So let's put our results in context. In tap drinking water, you should have an E. coli level of 0. It would be recommended you wouldn't want to swim in a lake which would have, say, 500 E. coli, but we had a level of 6,830.
OK, and I know you've been taking advice, haven't you, from doctors and whatnot. What do they have to say?
That's right. We went, where we went to get this sample is a GP surgery. He's actually now had to move to a local hotel, and this is what he told us about his concerns.
OK.
We don't want to have a national emergency about people feeling they're going to get dysentery or cholera. However, if you've got significant gut symptoms, mainly diarrhoea and colic, you should seek medical advice routinely by at least phoning your surgery and explain you've been exposed to floodwater so they don't think it's just a winter vomiting of virus.
It's also very unpleasant, isn't it, Nicholas? Apart from the fact that people have got their homes flooded, they've got to worry about this now. I mean, what do you make of it all?
Absolutely. Well, the fact that Escherichia coli is present in the sample is a good indicator of fecal pollution. So you should take a pragmatic view of the situation and just assume that other potentially more harmful pathogens are also present, such as enterotoxigenic E. coli or salmonella, and of course the waterborne
And what does that mean? I mean, it
norovirus.
sounds like you could get very sick, basically, if you, for some reason, get this into your body.
Yes, I mean, it could cause nausea, vomiting, diarrhea. These diseases caused by the E. coli, salmonella, the norovirus, they're all diarrheal diseases. So, yes, you could potentially be pretty sick.
And so how on earth do you guard against that, Cathy? What have the experts been saying to you? Because, you know, people have got children, they're in floodwater. It's the last thing they're thinking about is probably cleaning that, washing their hands every
Well,
5
you
minutes.
mentioned children. The last thing you want to do, I presume, is have them playing in this stuff. It might look like fun. Yes. And it's just basic hygiene, isn't it? It's things like
Yes.
washing hands.
That's right. Hand hygiene when preparing food, discarding any food that's come into contact with the water. And it could have long-term consequences as well with floodwater that's come into contact with crops on land.
That's a very good point, isn't it? So in terms of eating food that you might have in an allotment or a garden, what do you do about that?
I think 6 months is how long you've got to wait. Is that
Absolutely,
right?
yes.
Yeah.
That's the figure.
So no spring strawberries for anyone in this area, because you're going to have to leave it that long to make sure the bacteria aren't still in the soil.
And drinking water's fine, isn't it, Cathy?
That's a really important point to make, actually, because I've had tweets saying that a lot of people in the area are worried that the tap water is contaminated, and a lot of rumours are spreading. But as I understand it, there have been no reports of contaminated tap water.
That's right, and there should be no E. coli in the drinking water.
But just quickly, Nicholas, how long could this last? Is it as long as the floodwater's there, I suppose, or longer?
It's ongoing, yes, as long as the floodwaters are there. And then when the waters subside, norovirus can live in water, especially still water, for months. So you could potentially get sick for a while to come.
OK.